Hello. In this video, I will talk about Geniuslane targeted autism care. The three pillars of Geniuslane autism program are the three R's. Number one R is the reciprocity. So reciprocity means how uh, a child interacts with their environment. So usually when children are diagnosed with autism, they have strong agenda, they have strong mind, and they want to do their own things. And they reciprocate if we are interested in their agenda. But if we are not interested in their agenda, they might uh, either go back to what they're doing and show less interaction, or they might just do something what interests them, become repetitive. So reciprocity starts from a child 4 months of age, usually when they start to look around, aware of what is happening around them, make a sound, start vocalizing, start to gain attention towards uh, people and show interest in what is around them. By about 6 months, they start to explore it by picking it up, putting it in their mouth. And this is their way of interaction with their environment. Slowly, by 9 to 10 months, they start playing. They play jointly with others. They reciprocate. And that reciprocation is initially involving sounds, initially non-verbal language, looking, and slowly it goes more towards emotional connections. And all of that is changing the brain, and it is naturally programmed in the brain that how children will interact. So when children have autism, one of the very pillars that is affected is the reciprocity. So we measure that reciprocity and we understand what level is the child's functioning and provide a program to parents which they can do easily at home so that the child would start reciprocating. So we have found that when children start to reciprocate, the parents change, the child change. And that's why we have a very successful program because we mainly focus on reciprocating no matter what the child's interest and activities are, you can reciprocate. So that's one R of Genius Lane Autism Program. The second R is the restricted behavior. So when children have autism, they will restrict them with certain foods or with sleep or with people, and that is for no reason. Usually it is about how they feel. And usually a child with autism will feel distressed for no reason with normal things which other children would be just fine. So a lot of it is the child is trying to avoid a lot of situation, lot of people, um, because they feel distress. And when they feel distress, they restrict themselves, and it affects how they interact with the world, how they look after themselves, how they eat, how they sleep. So very important that this restricted behavior will not go by force. And if you force the agenda on the child, if you feel really disturbed by the restricted behavior and want it to change immediately, it will only get worse and worse and worse. So the second pillar of Genius Learning Program is restricted behavior, and we categorize their behavior to say, is it restricted behavior? And then we know what to do. So it's really important that a child with autism, we look at their restricted behavior, and restriction could be with their communication, could be with their non-verbal communication, could be with their diet, could be with their sleep, could be with where they go, how they behave. So restricted behavior is a very important part, and often people are treating it separately. So they're treating diet separately or sleep separately or eating, sleeping, making friends, all of this separately. And there are different therapies designed for it. So speech therapy, AVA therapy, sensory therapy. But the main core is restriction. And there is only one principle to address it. The third R of Geniuslane program is their repetitive behavior. So children from an early age can show a lot of repetitive behavior with their hands, with their face. They can make a noise. They can repeat sounds. Lot of the repetitive behavior make no sense. There's no reason for it. So children will just repeat to adjust to their environment, to calm themselves down. And the more they repeat, the calmer they are, and the more you're trying to force the agenda, stop the repetitive behavior and improve their restricted behavior, the more they go into the repetitive mode. So often, what we do with a child is very important. So understanding autism is really important. And if your autism program is missing the 3 R's, then later on, children will be more anxious. They can show more obsessive difficulties, or even they show more psychotic difficulties where they are more not in line with what is happening around them. So the brain is developing in a certain way when children have autism, and autism early intervention means addressing those 3 R's. Thank you.